So hi Sarah, here we go. Back again, tips of the week. And for March, we're going to talk a little bit about EDI and specifically reasonable adjustments. So I think it's important we remind everyone it's actually against the law to discriminate against anybody because of the currently 9 protected characteristics. Now we're going to go through those in more detail in the second sort of session on tips. So we're not going to do that at this time. But the important things to think about is how does your clinic demonstrate the awareness of EDI and show its commitment to reasonable adjustments? Because of course it all comes under the Equality Act of 2010 and it is important. So today we're just going to think about a couple of questions that we thought we'd ask each other to make people consider and things to be thinking about as part of this whole piece.
Yeah. So, Sandra, how do you prioritize accessibility and inclusivity within a practice?
So I think some of the things you're going to need to be thinking about here is about is the understanding if you've got a team, have they had training, is there that awareness for the whole inclusivity bit and thinking about the accessibility piece, are the doors a width that you can get a wheelchair through them? Have you got a ramp if you're outside to give people access? And are you making your clinic list accessible to people who need different times of the day? We're not building a clinic around when we necessarily want to work. What kind of clinic accessibility do you need for your demographic? And I think it's really important that you're looking at your demographic because every clinic is going to be different.
Yeah. So while reasonable is key, how do you strive to meet individual needs?
I think the thing people need to remember with reasonable is you wouldn't be expected to spend a large amount of money for, let's give an example, it's probably easier. If we think about a sole practitioner who might be renting a space above a gym, you wouldn't be expected to be putting a lift in to a small organisation like that on the occasional need for a wheelchair user. But what you could show as a reasonable adjustment is you recognise that accessibility could be a problem. So what you could do is if the gym has a room downstairs you could use, that could be your reasonable adjustment. You come to an agreement with them that you would deliver that session in that space downstairs. So reasonable is exactly that. It's what is it's reasonable to do and can you put in place to show that you're trying to be as inclusive as you possibly can. And I think the other thing to think about is if an adjustment isn't feasible, then what do you need to do with people, Sarah, who you can't make an adjustment to get them here?
Yeah, so what you need to be able to do is signpost them on,
Yeah,
send them somewhere where they can be accommodated and that requirement is there for them. So you can't just say, no, I can't see you. It's about, I'm afraid I can't see you. However, let me give you the names of a couple of clinics that would be able to accommodate you.
that's fine. So you're still being inclusive, aren't you, doing that?
Oh, yeah.
And also, I think the other thing that we've talked about with people is what about unconscious bias?
I know unconscious bias is a big topic. The best thing that you can do really is to go on the HCPC website and do their unconscious bias test, which is really good, really, really good. It's in such a way that you can't guess your answers. It just really, really teases out your own unconscious bias. And once you know that, you can then make sure that you are trying to address that.
Yeah, that's fine. And so I think the thing that we're saying is broadly what you're doing with your EDI and your reasonable adjustments is you're looking at your clinic size, you're looking at your demographic, you're looking at your caseload, and then you're working out what can you put in place if you need to do so. And what we're going to talk about next time is some suggestions of things to put in place or to have as a reference if needed so that you can show you've considered them. We'll see
Exactly.
you next time. Bye all.